I'm not a practitioner that believes that we get worse necessarily before we get better. Patients should either stay the same for the first couple of weeks, or they should start to gradually get better.
But now I think we can jump into the many questions we got about herbal treatment for UTI. The first one is around the mechanism of action for herbs and how they actually work.
So herbs are very different from pharmaceuticals. Pharmaceuticals are one particular molecule that is very isolated and delivered at a high concentration with a known mechanism, exactly how they work. Herbs, on the other hand, these are plants. These are that have multiple different types of molecules in them. So herbs have many, many different compounds in them. They're going to have hydroquinones, they're going to have tannins, they're going to have astringents, there's going to be molecules that are very anti-inflammatory. There's many different molecules within one single herb, and it's believed that this is what helps them have effectiveness in the human body, is because we're targeting multiple different actions within one medicine, essentially. Some of the well-known herbs for the urinary tract have specific antimicrobials that are being researched for their impact, and it's thought that they're the primary reason that those herbs are working, but that's not necessarily the case. A lot of patients know about ursi, so that particular molecule is called arbutin. A lot of people are using oregano oil, and that particular compound is carvacol. In some herbs, there is a compound called thuione that is thought to be the antimicrobial agent that's primarily working on these particular bacteria. And there's volatile oils. That's one of the other really well-known constituents that is able to act as an antimicrobial. And volatile oils are one of those compounds that are in a lot of different types of herbs. So, and what they do is they potentially damage the cell wall. When you damage the cell wall, then you have the cytoplasmic contents. They basically burst, essentially. Some of the herbs, their constituents, disrupt the hydrophobic nature of the cells. Some of them slow the growth. Some of them adhere to, right? We know a lot about the anti-adherent qualities with cranberry and with parsley, and there's many herbs that potentially have that specific quality. So that's what we think is the active constituent, but like I said, we don't necessarily 100% know, because there are just so many different compounds that are within herbs, and we definitely need more research on that. I mean, research is definitely very, very important, but one of the problems with herbal research is that there's not a lot of funding towards it.
Yeah.
Pharmaceutical companies, they really are only interested in being able to develop patented molecules. So studying a herb is not something that is going to help their bottom line. So we really look to our academic institutions to be doing these studies. And there's, of course, limited research. It's often government funded by various interest groups. So it is important to still look at historical use, because herbs have been used for tens of thousands of years as the primary medicine in many cultures. And the things that they're known for have been carefully looked at for long periods of time by doctors and herbalists that were using them. So even though that isn't a formal type of research, it's still useful information.
On the topic of the research, do we know how many herbs travel through the body? Do they actually reach the bladder, or are they thought to work in different ways?
So herbs, once we ingest them, they are going to be absorbed into the bloodstream, and their constituents are going to pass through the liver. Some of them may be broken down, but many of them are going to be filtered eventually by the kidneys and then pass into the bladder. So it is very important for patients to not be over diluting the active constituents when they, not to say be dehydrated, but sometimes I get patients that are having treatment failures, but I find out they're drinking 4 liters of water a day, right? So the concentration is very important in order for these herbs to act appropriately. And so besides just the circulation of the herbs in the bloodstream, or those constituents, not the herbs themselves, of course, but those constituents that have been absorbed, they can pass in through the bladder. The other thing to keep in mind is that most pharmaceuticals are actually derived from plant extracts. In the last 30, 40 years, 70% of pharmaceuticals did originate from extracts from plants that were discovered and then highly synthesized into a single compound for delivery.
It's interesting that pharmaceutical companies still won't fund that research then if they end up taking most of their compounds from plants.
Well, it's can they patent it, right?
Yeah.
It's can they take that, can they find that compound, can they patent it, and can they synthesize it in a lab? As simple as that might sound to someone, it can actually be very complicated to create a similar molecule as to what's found in a plant in the lab, and then be able to put a patent on that, because it can't be the exact same molecule. It has to be similar but different,
right?
And then that process is what gets patented.
Yeah. Are there different categories of herbs for different purposes, like prevention versus killing organisms versus repairing the bladder?
Yes, so absolutely. We have some really big heavy hitters in the antimicrobial herbal world. And then we have certain herbs that are very good at soothing, coating, healing the bladder wall. And then again, we have the anti-adherent properties in certain herbs that we use for preventing infections. So definitely that is a major way that we decide on which herbs to put together and go forward with a patient.
Are herbal remedies safe for children, and does the approach differ to that of an adult?
Herbal therapies are definitely safe for children. Children are great responders. They are typically much better at healing than we are. So we are able to use a weight adjusted dosage for them. There's a few herbs that I wouldn't use with children that are more on that stronger side.
Okay.
When we formulate for children, we tend to use more gentle herbs, and it tends to work because, like I said, they're great at healing those little guys.
Yeah. Very helpful.
Lucky them.
Are there certain scenarios where herbal treatment might be more effective than antibiotics? So for instance, if your symptoms are very mild, or if you have specific organisms or multi-drug resistance, or if you just have issues with taking antibiotics?
So herbal treatments are very effective at treating urinary tract infections. I don't think we have the research to say that one would be more effective than another, especially in these various different circumstances. Clinically, what I see is definitely for a mild case, an uncomplicated UTI, herbal therapy can be just as effective as an antibiotic therapy. Specific organisms, there is, again, it's so variable. There is too much genetic difference between, even amongst E. coli. E. coli in one area may be very susceptible to herbal therapies, and then E. coli in another area may be highly resistant. So unfortunately, that information still isn't, we don't have that. We need more research. But just because something is multi-drug resistant doesn't necessarily mean that it's going to be resistant to herbs. It's something that's still worth a shot for patients to try and see if that's going to help improve their symptoms, because symptoms are the thing that we're treating. We're not necessarily treating for eradication, and we shouldn't be. We should be treating to make patients have a better quality of life and have improved symptoms, and to getting to the point where they have no symptoms, right?
That would be ideal. When it comes to resistance, can organisms develop resistance to herbs in the same way they can to antibiotics?
Organisms have a much harder time developing resistance to herbs because of that multi-compound, many different active constituents that are potentially affecting the microorganism. So in that sense, it is difficult, and that's based on expert opinion. We don't necessarily have the research to say if we do find a particular bacteria that is resistant to a herb. I don't think anybody has done that research to figure out, why and what the mechanism necessarily, how it figured that out. What we do see in rare instances is when patients use very isolated compounds from a herb, like allicin from garlic, for example. Then it's starting to get more towards something like a pharmaceutical, a single agent that is an antimicrobial, and that gives the particular bacteria an opportunity to figure out how to develop a resistance. So not to say that single extract or a more isolated herbal product is going to put you at risk of developing a resistance, because it still only happens very rarely according to the experts, but it doesn't mean to say that it can't happen.
You mentioned earlier already that you can combine herbal and antibiotic treatment, but we also got a couple of questions about hyperx. Can you talk a little bit about what possible interactions there might be between hyperx and herbs if used together?
Sure. So hyperx is something that's very good at preventing an infection, very bacteriostatic, right? So whether or not a patient should be using herbs with it, if it's doing its job the way it's supposed to be, then you shouldn't necessarily need herbal therapies alongside it. However, if hyperx isn't, maybe it's partially working for a patient and they want to add a herb, you absolutely can do so. There shouldn't necessarily be an interaction with them, with the one exception of herbs that require a higher pH to be active. So we know ursi, for example, that arbutin that I mentioned earlier, it needs to convert to its active form, and it needs a higher pH in order to do that. So in those situations, you wouldn't want to use that herb, but that's just one of many that could be potentially utilized as an adjuvant to hyperx. So you can, for sure.
For those people who are on necessary long-term antibiotic treatment, are there ways that they can support that with herbs?
Yeah, absolutely. Because there are certain side effects that we're keeping an eye on when patients are on long-term therapies with antibiotics. So definitely yeast, right? That's probably the most common one. And there are lots of really good herbs that can treat yeast and help keep their levels down during antibiotic therapy.
Are there particular herbs or approaches that are used for specific bacteria?
So there are certain herbs that we can use that have more of a broad spectrum action against many different bacteria. We don't necessarily have herbs that per se work better against a gram positive versus a gram negative. Most of the research that's done on herbs, they look to see if that particular bacteria grown on a petri dish is sensitive to the herb. How sensitive is it to that herb? So what we do find is that some of the herbs are just they have that more of a broad spectrum antimicrobial action. So juniper, ursi, thyme, golden seal, those ones are kind of my favorites. They have that broad spectrum ability. But then we've got some bacteria that don't respond as well to those particular herbs. And one good example would be Pseudomonas. Pseudomonas, there's some research that shows that, for example, cinnamon is at certain concentrations is effective against that particular bacteria. And then there are some bacteria that we wouldn't even necessarily use herbs as our first line for. For example, staph responds to other nutraceuticals very well. Lactobacillus, if there's an overgrowth there, that cytolytic vaginosis, for example, we don't use herbs at all. Again, we would tend to try a baking soda based type of therapy. So it's going to depend on the organism for what you're going to use best for herbs.
Right. And how are the doses formulated for herbal use?
So that again goes back to both traditional use and also research. So if we've got that research to show that it's a certain dose that we need, then that's definitely what we go with. But then when we, in lieu of that, the traditional herbalists usually have throughout the years been recording the dosage that they find effective, and it usually comes out as a range. So we have, if we have a more sensitive patient, we start in the lower end of the range, and if there is a patient who is more treatment resistant, we might start at a higher end of the range. The one thing to really understand about herbs is that most commercially prepared products are sometimes as low as a quarter to an eighth of what's considered the therapeutic dosage range. So yes, they work for lots of patients still. We know that from the communities, right? Somebody used X supplement and cured their UTI. So it's definitely not to say that it can't be effective at that dosage, but often for most patients, we need to be using herbs at in the appropriate therapeutic dosage range in order to make sure that they're getting enough of those compounds to actually eradicate the infection or start to eradicate it, depending on, whether it's a more superficial infection, right? An uncomplicated UTI patient versus a potential client or patient, that has an embedded infection that goes deeper into the wall.
That was going to be one of our questions about the herbal products that are available and the dosages of those. But it sounds like even if you've used something that is generally available, it might not be effective, but that's more because of the dosage potentially than the actual herb itself.
Yeah.
When it comes to herbal treatments, what method of delivery do you use? Or maybe it's multiple, like tinctures or powders or pessaries?
So I often use tinctures if patients tolerate alcohol well, right? And that's the deciding point there. Tinctures are particularly effective because alcohol is a solvent that is able to dissolve both the hydrophobic, so essentially the oil-based compounds and the water-soluble compounds, hydrophilic. So having a solvent that can get all the medicinal qualities out of a herb is potentially a more potent therapy. And there are ways of getting the alcohol percentage or the amount of alcohol in the product way down. It's a bit of a complicated process. You can't just add it to boiling water. That does not evaporate much of the alcohol at all, despite maybe being told that that's an effective way of removing it. So there is still another method that can be utilized if a patient is sensitive to the alcohol. From there, if alcohol is definitely not tolerated, then usually a powder. Tablets tend to not be a good choice in general, unless the formulator is very careful with how their tablet is manufactured so that it dissolves effectively. A lot of the urinary patients, they also have very damaged digestive systems, unfortunately, because of all the antibiotic use. So putting medicine into a very absorbable form, liquids especially, is going to improve the ability for that medicine to make it into their body and get to their bladder. So powders at times, definitely. Pessaries sometimes, especially if there's a vaginal infection. Sometimes we do microgen and we see the same bacteria is colonized in the vaginal canal, and then we would treat that area in order to help prevent a reoccurrence happening in the bladder.
Okay. How long does it usually take to treat a UTI if you're using the herbal approach?
Extremely variable, right? Again, it's going to depend on how advanced that infection is, how long they've had it. There are even cases where people have had it for a long period of time. 2 years, and I know there are a lot of patients that have had it much longer than that, but there isn't a hard and fast rule there. I usually tell patients, at least a month, as long as we see some improvement, then we keep going. But sometimes patients respond within a couple of weeks. So I had a patient that was experiencing upwards of 30 urinations a day, frequency. And she had been told she had overactive bladder, and we did some testing. It looked to be that Pseudomonas was potentially colonized, and it hadn't been treated. So we did herbs, and within a month, her frequency had gone down to a normal range, 9 to 12 times. And we continued to see if we could get even better, and it stayed where it was, but that's fine. That was a much better quality of life than 30 times.
Yeah, much.
Yeah. So it's even duration of symptoms doesn't necessarily dictate how a patient is going to respond to the right herbal therapy.
And people often talk about potential liver damage from long-term herbal therapy. Is that an actual risk?
For some of them, absolutely. I know I've talked about ursi multiple times. This is probably one of the ones that you need to be the most careful with. It's really not meant for long-term use. You can use it safely up to a certain amount of time under guidance. And then if you were to use it longer, liver enzymes would need to be monitored. So definitely, the liver can be impacted by any nutraceutical, any herb, especially if you're taking it for a while. I've been to webinars on liver function where practitioners have found patients using, if you're, even as few as 5 different supplements, and found liver enzymes elevated. And then when they took those away, or some of them away, the liver enzymes came back down. So it's not just herbs. We do have to be careful with all products, making sure that our body is tolerating them. There aren't any herbs that, besides ursi, that have where we would say you have to monitor liver enzymes continuously every 6 weeks. But if a patient had a history of a liver condition or enzymes that were elevated, then we might.
How do you know if a herbal treatment is working? And then how do you know when it's safe to stop and that you won't then just get symptoms again?
So I'm not a practitioner that believes that we get worse necessarily before we get better, unless it's a Herxheimer reaction that we see for a couple of days. Patients should either stay the same for the first couple of weeks, or they should start to gradually get better. Sometimes there's compounding factors. Maybe a patient started therapy at the same time as their cycle started, and they were feeling kind of crappy from a different facet to their health. But generally, we should see that patients continue to improve on therapy. Stopping the herbs that have been effective for you is an individualized decision process. If it's going to just cause stress, stopping a herb that's relatively safe, right? We all know our stress significantly plays a role in the development of these conditions. So that's something to discuss with your practitioner. It's very important to work with a practitioner who's trained in botanical medicine. There are a lot of herbs that maybe state online somewhere that you shouldn't use it for past a certain duration. But a lot of those websites are taking a very cautious approach, whereas someone who is trained in herbal medicine, they would be able to better guide you on the duration that you could safely use it for, as opposed to, stopping something that's working for you before you feel comfortable stopping it.